comadre, ¿cómo estás? How are you? Alright, so today I have my comadre Jenny and my comadre Victoria. Victoria is our special guest today. She's got so much knowledge for us. So, Victoria, how would you like to introduce yourself to the audience?
I am Victoria Rees, and I live here in Las Cruces, New Mexico, where I work with Cynthia Ordonez Bronco. She is the director of Evolvement Behavior Health, and we are a private practice that specializes in marriage, family, adults, children, and substance abuse. And I've been working here for about 3 years now.
Yay! Actually, before we continue on, real quick, I just wanted to say there is a little bit of a delay, so we just ask that the listeners have a little bit of patience. There's probably going to be some awkward silences. We're going to try and edit that out as much as we possibly can. Go ahead, Val.
Jenny has prepared some amazing questions for Victoria. Again, I just want to thank Victoria because through her hard work and through her education, she's been able to, just have more knowledge in this area than myself and Jenny. So first and foremost, I'm just thankful for Victoria and her knowledge. And with that said, I'm going to hand this over to Jenny, who will be asking the majority of the questions, and then Victoria, who will hopefully answer those to the best of her ability. And I will also try my best to come up with questions and think of, things that the audience, like myself, might be wondering. So Jenny, take over.
Yes! So, first of all, I'm very excited because literally since day one of starting this podcast, Val and I have talked about how we want the podcast to grow, how we want it to expand, and we've kind of like dreamt up a dream list of people that we want to interview. And from the very beginning, I was like, we have to have Victoria. Victoria is my step cousin. I consider her real family though. That's just a label in my eyes. And we grew up together. I don't even remember how old I was when we met, Victoria. Do you remember?
I think you were like 12, like 11, 12,
Yeah.
around that age.
Yeah, that sounds about right. So obviously we've known each other for a very long time. I feel like, so Victoria and I have quite an age gap. I think we're like 6 or 7 years apart, I want to say.
Yeah, I think so.
Yeah. So that being said, I feel like we were very close whenever I was like in that middle school range. Victoria would always come over to my dad's house, who also lived with my step grandma. And so that was kind of the central hub of the family. And we would play Dungeons and Dragons, and we would draw our characters and have so much fun like imagining this different life and just, using those active imaginations. Victoria has always been such a role model to me, and I remember watching her like draw her characters, and I was like, oh my god, I wish I could draw like that. And I just loved hanging out with her. So very close. And then I feel like once we kind of started getting older, it was a little bit hard. I know you lived in Arizona for a little bit. Is that right?
Yeah, I lived in Arizona for about 2 years and then I came back.
Yes. Okay. And then once she came back, I think at that point I was either graduating high school or probably getting close to heading into college. So our relationship kind of flourished in a different way. I feel like we were more, instead of it being like such a big sister, little sister kind of thing, it was more like we could bond because we had more common things to talk about. And then I moved away, so it was hard to kind of maintain that close relationship, but every time I come back to Las Cruces to visit, I try to make an effort to go see Victoria, and so I've seen her blossom and take interest in therapy and mental health and eventually go into pursuing her degree. So Victoria now has her bachelor's and she's pursuing her master's, which she will be graduating in May of 2027. I asked her right before we started the episode what her official title is, just because I don't want to butcher it. So she is a licensed substance abuse associate. So while she is in the process of finishing her master's, she has gone through a few different residencies and she already is able to take clients. So we wanted to bring her on today to talk about alcoholism, substance abuse in general, especially because it is so prevalent in the Latino community. I'm gonna be honest, guys, this might ruffle some feathers. If this is something that you're working on at the moment, it might be the perfect episode for you. It might trigger you a little bit. I want to invite you to be honest with yourself as you listen to this episode. Obviously, everybody's relationship with alcohol is different. For some people, it's not a big deal for them to monitor it so much. And so if you're in that category, definitely take what resonates and leave what doesn't. However, again, keyword, make sure you're being honest with yourself. Don't be like, oh, that doesn't apply to me. If you are in denial and you might have a few of these different signs. So we are going to talk about that today and kind of what signs to look out for if you may be suffering from, a not so fun history with alcohol, or if you're a family member of somebody who is suffering from that, or a friend as well. So yeah. Any other thoughts before we all get started and get into the questions?
No, I'm ready.
I don't have any thoughts. I'm ready, yeah.
Okay.
Let's go. Let's do this.
Okay, so I just talked about how I know Victoria. And Val kind of has been introduced to her, but they haven't actually met in person. So I don't know if Val, you want to speak on that, or if you have any specific memories that you want to talk about whenever
we have met in person.
I introduced you guys. Oh, you have?
Yes,
oh,
so
okay.
we have met. Yes, so I've met Victoria, and I think I went to her house once, and I got to see a lot of her really cool artwork. So mostly I've connected to Victoria through her art. I remember seeing her artwork, and I actually remember you posting your artwork, like artwork for sale, or this piece is going for like fill in the blank. But I mostly remember connecting you through art because I am also a fellow artist. So actually, I really admire your art. So that's how I have related to Victoria.
Thank you.
We've done some fitness challenges with Jeni in the past. She used to host fitness challenges, so I used to do that with her. She was one of the members. And then I also remember seeing her journey through psychology. I took a different route, so I went the behavioral route. So my background is more on behavioral, more conditioning. And I'm actually really excited to see this because I don't have a lot of background in this. I would like to know more. So I'm actually super excited to hear from Victoria and just learn from her, actually. Yeah.
Yeah. And that's one of the things that we really wanted to stress on here. We mention it every now and then on the episodes that Val and I do have our degrees in psychology. Val has a master's in behavioral analysis, but we are not licensed. We're not licensed therapists. So as always, consult your doctors. Make sure you are going to the right channels and resources so that you can get the proper help. This is for educational and entertainment purposes only, but it's nice to have somebody who is a little bit more qualified and has the licensure to be able to give us this information. Without further ado, let's get started. So first question, how did you get into your field of work, and what made you decide that you wanted to go into the mental health field?
That's a loaded question. So about
we're getting real deep already.
Years ago, yes, I gave birth to my daughter, and as we know in the Latino community, we're not very big in mental health, so it's not really talked about as much. And when I gave birth to my child, I was experiencing something that I've never experienced before, which was depression. And it was very strange because in being in a Latino family, having a baby is very much a happy thing. It's like the baby is passed around, we're all happy, there's a new life, and all of these wonderful things, and I was crying every day, all day. And I had severe anxiety. So as time went, it started getting worse, and I have to admit that I was getting into a very dark place. And this was very scary because, again, I've never experienced mental health before. That I know of. And so at the time I was married, I had gotten married while I was pregnant. I was, I think I was about 38 weeks when I got married. And, me and my husband have been married for 11 years. We've been together for 12. And during that time, he noticed that something was wrong, and so he had a serious talk with me, and he was very concerned. He's like, hey, something wrong, you've been very sad, and we need to see if we can get you some help. So I got into therapy, and I was diagnosed with postpartum depression, postpartum anxiety, and I had experienced that for about 5 years, I believe. And as I was going into therapy, I was going in completely blind. I had never been into therapy. I have never discussed it. I have never discussed mental health, so it was all very new and challenging. So when I went in, my therapist encouraged me to dive into my diagnosis, and that was it. That was it from there. I got a book. I actually have the book here. This is the book that I have found, and I will forever keep this in my office. This is the book that changed my life: Healing Anxiety and Depression. And there is a section in here about postpartum depression and postpartum anxiety. And I was like, that resonates with me the most. And I could see why she had diagnosed me with that. So after that, I wanted to look into more. I was so engrossed by the mental health disorders, and I wanted to look into more what qualified as a disorder, what the criteria was, and then my therapist told me about the DSM-5, and that was it. I even have my first one here. This is actually the one that she gave me. She gave me her DSM, and this is an old one. This is, I believe, from 2003, I think. But it's an old version. It's the 4th edition. We have the 5th edition now. But as you could see, I read that thing a million times. That was that. So I got into that, and I told my husband that I wanted to help people. And he was at the time going to school for aerospace engineering and physics. And he started working at the Boys and Girls Club, which he worked with Jeni at the time. And they worked together for what, like a year, I think?
Yeah, it might be like it might have been like a year and a half.
Yeah, I think it was about a year and a half. Because we were on campus for a while. But he went into that field, and then as he was getting close to graduating, I had started getting into all of this stuff. So he was like, you know what? Go for it. Go for, whatever your heart desires. If you want to be a therapist, do it. So I did a lot of research, and for anyone that wants to be a therapist or a social worker, I highly, highly recommend you do as much research as possible, because I have seen time and time again that many therapists will go into the field and they are going in for the wrong reasons. But I highly, highly recommend any kind of student that wants to get into this field, do as much research as possible. And that's what I did. I looked into any kind of therapist that would deal with this kind of thing. And I mainly wanted to work with women that were experiencing postpartum depression and anxiety and postpartum psychosis. But I had later found out that men, fathers, experience this as well. So I figured that I would get into the field of working with families and couples. So licensed marriage and family therapist it is. So I started looking into it, and I was really into psychology. So I started looking into schools, and my mother-in-law recommended SNHU, which I love. I will highly recommend that school to anybody. And I got my bachelor's in psychology with a mental health concentration. And then as I was going through school, I started working at Mesilla Valley Hospital. And Mesilla Valley Hospital here in Las Cruces is a behavioral health hospital. And it's what you would call a mental health hospital. And anyone that was experiencing any kind of like suicidal ideation, homicidal ideation, there was some people that would come from prison that would go there. There would be children, adolescents, and adults. They would all go and get admitted involuntary or voluntary into the hospital. So as I was working there, I was going with the intention of internship. But as I was there, I heard many times from other people that if you were to go into an internship, they had a contract. I don't know if this is true or not, but you would have to sign a contract that you would have to work for them afterward. So I was like, no, I don't want to do that. So as I worked there, I was like, okay, I'm just going to work here, get the experience, and start looking into other internships. So that came in where I was looking into LinkedIn, Indeed. There was a program, I can't remember what it's called, but it's for looking into internships around the area. And I was looking around, and I found a post by my now boss, and she was looking to hire a therapist. So I messaged her on LinkedIn, and I was like, hey, are you taking interns? Because I am working at Mesilla Valley Hospital, and I really wanted to get into the field that you're in. And she's actually a licensed marriage and family therapist and a LADAC, which is a licensed alcohol and drug abuse counselor. So I was like, this is perfect. This is like a godsend. This is just right in the line of what I want to do. And she's like, yeah, I'll hire you to be a receptionist, and then you can work your way from there. So I quit Mesilla Valley Hospital after a year. I think it was like November of 2022. And I went into my now boss's office, and I was like, hey, I want to come and work for you. Can we still do that? And she's like, yeah, come on in. We'll hire you, and you can start, I think she said it was like in December. So as I started working for her, she started teaching me everything that had to do with private practice. She told me to look into all the licensures for substance abuse counselor and licensed marriage and family therapist. And she was always giving me work to do. She was always telling me to do research, look up the licensures, look up the statutes, look up the ethics, everything, so you can get to know the licensures and the ethics and what goes into that. So as I worked with her in reception and internship, she gave me books too. She would give me books, and she would give me recommendations on, what are some good books to read, what are some good videos and TikToks, and she's very knowledgeable in this field, so I'm extremely grateful for her. I've learned a lot from her. Ever since then, I've been working for her. I've been working for her for 3 years, and now I'm taking clients. I'm no longer a receptionist, and I've just been focusing on my substance abuse clients and continuing my master's, so I can later on, when I graduate my master's, I can take the exam for my licensed marriage and family, and I'm hoping to do my licensure for my LADAC as well after.
Awesome. Well, thank you for sharing that. I do remember when you had first given birth and you were going through that hard time and struggling. So before we do move on, I do want to say I can see how much growth you've made and how much more peaceful you are as a person. And that makes me happy to see that the therapy, it does what it needs to do. And not only that, but you got bit by that bug and you were like, I gotta learn more. And like, that's obviously one of the reasons why Val and I started this podcast, is because psychology is so interesting to us. So again, for all the viewers or listeners, we just hope that you guys are taking an interest and just keeping your mind open as we continue to talk about the topics. So our next question, and this is just kind of me with my own curiosity, what does a normal day in the life of a therapist look like?
It depends. It depends on the therapist, it depends on your niche, and it depends on your workload. For me, I have a caseload of 33 clients, and some of them are weekly, some of them are bi-weekly, some of them are twice a week, some of them are once a month, so it just depends. But I will see probably about 7 to 8 clients every day. That would be from 9 or 10 a.m. to about 5 p.m. And sometimes I will get reschedules or cancellations depending on what it is, but usually it's pretty sporadic because of the field that I'm in, my niche, I should say, because with substance abuse, there is a lot of possible withdrawals that could happen. There's a lot of possible treatments, so higher level treatment that clients might go into. There might be arrests, so I deal with arrests a lot. I deal with overdoses, and so it's a very sporadic schedule for me. And so most of the time I will have like 1 to 3 cancellations or 1 to 3 reschedules every day. It's off and on, and again, it deals with your niche, and it deals with the type of workload that you have. And for me, I try to work every day, all day. Sometimes I will work holidays. I usually tell the receptionist that I do work holidays, except for Christmas Day and Thanksgiving Day.
I kind of want to pivot in a direction for maybe those who are a little bit scared of going to therapy. Obviously, it's very stigmatized. I think a lot of people, they think that they either have to have something really huge and traumatic happen in order for them to start going to therapy, or maybe they think that therapy is only for crazy people, quote unquote. Or maybe they think that therapy just doesn't work. Or I know another common belief is that there are therapists out there who just want a paycheck. And so instead of trying to get you to a place where you can actually heal, they're going to keep you there so that they can keep getting the money. And so let's debunk some of those myths. But I also want to ask you, what can somebody expect in a first session in therapy overall? Maybe if they are scared, giving the breakdown of how that all looks would help them to not be as fearful of going into that initial session.
Sure. It actually, again, depends on the therapist, and it depends on the agency. It depends on the practice. So a lot of different places will have different policies and regulations for intakes or admissions. And usually for us, what we do is we can receive calls. We can receive calls, emails, or connection through Psychology Today. So you can get to us by Psychology Today. And we all, I believe most of us have a profile on Psychology Today. Actually, most therapists have profiles on Psychology Today. And you can go to their profile and you could see what they're about. You could see the kind of models that they use. You could see the insurance that they take. You can see the kind of, maybe if they do sliding scale. But you can go on there and just about find anybody. And that will be a really good way for you to find a therapist in the area, is look into that. Or you can look into, Google. I've been found by Google from what my clients have told me. Some people will just type in substance abuse or, mental health or depression or whatever into Google, and they'll find a therapist. So usually what we do is we will send email of standard information, so your name, address, date of birth, number, all of that good stuff, so that way we can get all of that information first and we can put it into our program, our website, which we use as Therapy Notes. So with Therapy Notes, we put all that information in, and you can create a profile if you're going to be with us, and we will send you paperwork for intake. So that's going to be like demographics, insurance claim, psychiatric directive. It's going to be like emergency contact information, and then we'll do assessments. So depending on the therapist, or again with the agency, we will send different types of assessments. So that could be an assessment for standard one is PHQ-9. PHQ-9 is a depression assessment, and it'll decipher the severity of your depression. So things like that. And then once you get assigned to a therapist, and again, this is, for our private practice, once you get assigned, the therapist will contact you, and you will establish a date that you can come in for intake, and the therapist will ask you a bunch of questions. Sometimes these questions can be intimidating. It's going to be about your substance abuse history, your trauma history, your family history, your relationships, your intimate relationships. It's going to be about your medical conditions, your medications. So it's a lot of information that you're going to have to do on the first day. And it's going to be for us so that we can see what kind of person you are and what your history is. And depending on what your history, we can get a gauge on what your treatment can look like. So we will create a treatment plan based off of the intake and what the information that you've given to us, and that's going to help us treat you. So that would be the first session. And for me personally, I structure it in an educational sense. So after I do the first intake, I will do the first session as a psychoeducation. So depending on the substance abuse that you have partaken in, so it could be, alcohol, opioids, cocaine, methamphetamines. It could be any kind of substance, or it can be process addiction. So I also work with process addictions as well, and that is gambling, sex addiction, it can be pornography addiction, it can be food addiction. So I will do a session just based off of the education of that substance or addiction. So I'll usually talk about the education or I'll show some videos. The videos are pretty informative. They talk about, what it does to the body, what it does to the brain, what it does psychologically, and it'll go into a scientific level and what it does to the organs. It goes into short-term and long-term conditions. So the substance that you're using, it will talk about what you can expect short-term and what you can expect long-term. And then it will go into withdrawal symptoms. So we will watch videos and talk about withdrawal symptoms and what you can expect. And then after that, we do talk about, the severity of the substance. So if it's pretty severe, and that's another reason why it's really good to talk about this in intake. So just a disclaimer, please, please, please be honest in your intake. It is extremely important to be honest, because if you are not honest, it's not going to help us treat you. And we need all of the honesty in kind of mental health that you have or any kind of trauma you have, because any of those can get in the way of your treatment. So please be honest. Whenever we see the severity of the substance or the addiction or mental health, we can cater the treatment plan to that. And that's going to go with the diagnosis as well. So we will have to code on the diagnosis of what you are and the severity. And that's also very important as well. And with the treatment plan, what we'll do is we'll create goals for you. And we will discuss that in session 2. What kind of goals do you want? Do you want to decrease your use? Do you want to quit, eventually? Or do you want to talk about higher level treatment? And that's just for me, for substance abuse. But again, I know that different therapists and different agencies and different hospitals have different policies on admission or intake, so it just depends.
Yeah, and you mentioned something that brought up another barrier that I just thought of, which is finances and insurance coverage. I know a lot of times people are, one of the barriers of them being able to get therapy to begin with is they might not have insurance, or maybe their insurance just doesn't cover therapy. And so for them, they're like, oh, well, I just can't afford it. So you mentioned the sliding scale, which for those who don't know what that is, there are certain therapists that provide a lowered fee so that you have the access to therapy. So when I was in therapy, my therapist, she stopped working at the agency that she was at, and she went into her own private practice. And when she did that, unfortunately, the insurance that I did have was no longer covered by her private practice. But because we had been together for so long, she offered me the sliding scale option. And so for me, I was able to pay $50 a session. That's just one example. It might be more, it might be less for whoever is watching this. And then the way that I did it so that it was still affordable for me was I started going every other week instead of every week. So that's kind of how we worked around it. If you are afraid to start going to therapy because of that financial aspect, I highly encourage you to just Google the therapists that are in your area that do have that sliding scale option and just give them a call. Ask them questions, see what they offer. If they don't offer it, I'm sure they'll give you resources on where you can find somebody that does offer it. So that is definitely, I'm glad that you brought that up.
It's a part of the field. It's a part of being a therapist, so it's important. It's how we get paid.
Yes. Yeah. So the next question I wanted to ask, which you kind of already touched on, is like what addictions do you normally see? Like you kind of mentioned that you touch a little bit on everything, not just drug addiction, but also things like sex addiction, food addiction, and so on and so forth. Are there any others that you might have missed that you didn't mention?
I mean, I can list them all right now if you want.
Yeah, sure.
So I work with alcohol, I work with fentanyl or opioids, I work with cocaine, I work with methamphetamines, I also work with, what else? Because those are the most prevalent here in New Mexico, is cocaine, methamphetamines, fentanyl, and alcohol. I also work with, when it comes to addiction, you can get addicted to a lot of things, and I've had people become addicted to, hand sanitizer because of the alcohol. I've had people get addicted to the aerosol cleaners. Like, there's a lot of things that you can get addicted to, and I will work with that. I will work with any kind of addiction, basically, and I will help you through that, and I'll help you decrease your use or stop it completely, or we can talk about, again, higher level care if you need to.
Okay, so now we're going to kind of pivot and get into some of the nitty gritty questions. So it's going to get a little juicy here. This is probably going to be a pretty long episode, so there might be a part 2 depending on how Val and I are able to edit it. But what are some of the signs to look for in someone who may be experiencing addiction?
It depends. So it depends on the substance, because different substances affect women and men and adolescents and children differently. And it also depends on the severity and how much you're using and the frequency that you're using. So it all depends. And this would take a long time to go through because there's different symptoms and there's different effects to every substance. So with alcohol, I would say, again, there's different severities. There's mild, there's moderate, there's severe. Even in the mild, we usually go by the criteria of DSM, or we do an assessment to get a gauge on the severity. But for alcohol, I would say look out for feelings of anxiety and depression. There's high functioning and there's low functioning. So with low functioning, that would be, depression, that would be anxiety, that would be the inability to do regular things because of your use. It would be the inability to go out and do the things that you used to, that you used to enjoy. It would be irritability. It would be anger or angry outbursts. It would be anxious pacing, the inability to sit still, or the inability to get out of bed. So that would be alcohol, and that's also some of the criteria for other substances as well. But with other substances, again, it depends. So with fentanyl, it's very lethargic. If people are going to be on opioids or fentanyl, they will be very lethargic. They will be very tired. They'll be nodding off. They'll be very sleepy, and it will be very hard to understand what they're saying, so they'll kind of mumble, or they'll talk really low and really soft. Sometimes that's the case with alcohol too. With alcohol, there will be a lot of slurring, and sometimes there's a lot of fast-paced talk or slow talk. So again, it depends. And I also work with cannabis. I work with cannabis use disorder as well. And that's kind of finicky because if it's severe use, it's the frequency. Cannabis, if you are using cannabis throughout the day and it's to the point where you cannot function, then there's a problem. If you are using cannabis medicinally and you're using it every once in a while for those therapeutic benefits, then that's something different. And again, with every substance, it's going to be different effects. It's going to be different symptoms to look out for. And usually, the depression, the anxiety, the irritability, the outbursts, the, not doing things that you used to, not visiting with people, or too much. So, maybe it's the other way around. You're avoiding something.
Okay. And I think I know the answer to this question, but just for those who may not know exactly what a timeline looks like, what point in somebody's addiction would you recommend that they reach out for additional help? Obviously, as soon as possible, but are there any common patterns that you look for? Obviously, you said it is individualized depending on what substance they're using, if it's being abused, I should say. But is there anything common to look out for in somebody who might experience it themselves, or maybe a family member who is noticing that for, somebody that they suspect might be addicted?
I mean, you could gently discuss it with them. Usually when you confront somebody about an addiction problem, it's very finicky, it's very intimidating because you don't know how they're going to react. They could be angry, they could be sad, they could, you don't know what's going to happen. But you could gently let them know that you've noticed these behaviors in them and that you are concerned about it. And again, you don't know if they will react in any kind of way, and it's up to them if they want to change. And if they want to change, it's up to them. If they don't, it's up to them as well. You can't force somebody to get treatment, but you can let them know what you've noticed and how it makes you feel and your concern for it. If they're willing to get help, you could always give them resources.
A few moments later.
All right, friends, we are back. Unfortunately, we had some technical difficulties. We lost Victoria for a second. So we're gonna try and edit that. It might sound a little bit choppy. We're just gonna move on to our next question. So the next question that I have for you, Victoria, is for a family member or friend of somebody who is showing signs of addiction. What advice would you give them on how to help that person who's afflicted? I know on the last question you briefly mentioned, unfortunately for that person who is experiencing addiction, they're going to have to want the help more than anybody else, and they're going to have to be the one to do that work. But I know a common experience for those who are the family members or the friends is obviously they're seeing somebody that they love go down a very scary path, and they may feel very out of control of the situation. And it obviously they can't control them, but are there any things that they can do for their own self-care, as well as things that they can do to still help that person who is experiencing addiction?
So again, like you said, it's very difficult. It's a very intimidating thing to confront somebody about their addiction. And I have to stress this: when you are confronting somebody about their addiction, again, you don't know how they're going to react. So the best way that you can do it is, tell them what you noticed and express how, concerned you are and how it makes you feel. And it's up to them if they want to, indulge in that conversation or if they don't. But for the person that has that difficulty, that is trying to help that person, just be an open door. Just be a support for that person. Just allow them that space to talk. Because the majority of the time when someone is going through a substance abuse problem or an addiction, they need someone there to talk to. And one of the things that I've noticed with substance abuse is that the lack of support is one of the biggest reasons why they relapse. So if you're going to support somebody that is struggling with addiction or substance abuse, be there for them. And you can be there for that person with boundaries. You can have boundaries with that person. So you can, let's an example. It could be like, hey, I've noticed that you've been irritable lately. And I've noticed that, you've been drinking a lot lately, and I've been really concerned, and I was hoping that you would like to talk about it. Something to that nature that is very calm and it's not demanding or abrasive. And if they want to talk about it, it's up to them. If they don't, they don't. Now, if they don't, you could say, okay, I understand that you don't want to talk about it, but I am here if you want to talk about it. I'm here if you need anything. And if you ever need anything, if you ever need, someone to talk to, or if you want help getting resources, I'm here for you. And again, I have to stress this to people that are trying to support people with addiction. Please try to meet them where they are. They are most likely going through a lot. They're most likely going through the fact that they are addicted to that thing, that they are struggling with that addiction. So it is hard for them too. Just notice that and understand that, it's very difficult for them to face the fact that they are struggling with that addiction or the denial. So they might not know or want to recognize that they are struggling with an addiction. And it looks like Val raised her hand.
You guys, I was such a good student. I was like, I have a question.
We're learning new features.
Victoria, you're great. You're like, Val, you have a
Sure,
question.
what's
So you
up?
raised your hand. Okay, so in family dynamics, especially like in Latin culture, we throw big parties, big celebrations, and when it comes to boundaries, like what might that look like? Because it feels like, and I will speak for myself. I'll give myself as an example. Whenever you have a party and maybe like there's a problematic person and you know that they're maybe not problematic, but they're going through whatever they're going through. And we're all going through something, whether it's a major
Mm-hmm.
life change, getting married, having kids, getting a new job, maybe the loss of someone. We're all going through something. But there's like, let's just say there's a person and they're struggling with substance abuse. And you're going to throw a party or celebration, or there might be alcohol, things like that. Or maybe they're in a state where there might be in denial and they don't want to assume responsibility for their substance abuse. Like, what do you suggest we do there? Because I think there's a side of the person that is dealing with the substance abuse and maybe they're getting help, maybe
Mm-hmm.
they're not there yet. But then there's also the family where it's like, well, what do we do? Do we just like not invite you to things, like don't show up, or like do we invite you so you're not excluded, or do we talk to you about it, like, hey, there's going to be a party, you're more than welcome to come? Or how do you deal with that? Like, how do you deal with those dynamics, especially in our culture?
So this subject comes up a lot in sessions. So I know the outside look of it and I know the inside. The people that are struggling with the addiction, again, there's a possibility that they're in denial or they're numbing. So usually when you're drinking or you're using a substance, you're numbing yourself. You want to be in that state of not feeling anything. And again, whenever you're approaching somebody that is drinking, go with caution because, again, you don't know how they're going to react. If you see that their behavior is erratic, stay away from them. Stay as far away as you can, but also let them know, like, hey, what's going on? Is everything okay? Do you want to talk about it? Let's go outside, or let's go to a separate room and talk about it. If you don't feel safe with that person, then I would suggest that you call the authorities. You call the police. But if you were able to contain them and you're able to be like, hey, like, what's going on? You want to talk? I notice that you're, kind of irritable, or I notice that you're, upset. Then take them to a secluded area where you could talk to them freely and safely. But again, when you're dealing with people that are extremely drunk, you don't know what they're going to do. You don't know how they're going to react. The thing that I learned about in Mesilla Valley Hospital is that you always kept a distance because you don't know how anybody's going to react in any kind of substance. You don't know if they're going to get aggressive. You don't know if they're going to, have an outburst or yell or try to hurt you in some way. And with alcohol, that's very prevalent, or with opioids. So you have to be very careful when you're dealing with somebody that is intoxicated. But again, always call the authorities if you feel that you are unsafe. If you feel that you are unsafe, then that is grounds for calling the authorities. And don't ever deal with somebody alone. Have someone with you. Because even if it's, just one person, you need to have somebody else with you just in case. Because you don't know what's going to happen again. Now, with the Hispanic culture, again, I've talked to this out everywhere. Alcohol is everywhere. Alcohol is in media, alcohol is in stories, it's in movies, it's in shows, it's in celebrations, traditions, especially in Hispanic culture, it is everywhere. If you are dealing with addiction and you're dealing with alcohol and you want to have boundaries while going to parties, while going to hangouts, and knowing that there's going to be drinking, get a gauge on what you're comfortable with. If you're uncomfortable with going to a place because you know that there's alcohol and you know there's going to be things that are triggering for you, don't go. You don't have to go. We have free will. You don't have to go to places if you don't want to. If you do want to go and you know that you'll be able to manage your triggers, then have boundaries with yourself and have boundaries with others. So what that looks like is, let's say someone offers you a drink, which is very standard. You can politely tell them, no, I'm not going to be drinking tonight. And you don't have to tell them why. You don't have to explain it. You could just say, I'm not going to be drinking tonight, no thank you. And if they push it, then restate the boundary. Restate and say, I already said that I don't want to drink, so please respect that I'm not going to be drinking tonight. And if they do it again, rephrase it. And if they make you feel uncomfortable, leave. Again, free will. You can leave. Now, I always tell people, if you are struggling with addiction and you're going to a place where you know it's going to be triggering for you, there's a couple of options. That having boundaries with somebody else, and then boundaries with yourself. Know, again, what your triggers are, but also have that positive self-talk. Ask yourself why. I tell my clients this all the time. Ask yourself why you are getting a craving or an urge when you're around alcohol. Could it be stress? Could it be anxiety? Could it be socialization? You want to be a part of the group? Why? Why do you want to be a part of the group? Could it be that you're depressed? Could it be some conflict happened beforehand? Ask yourself why you are craving and having an urge to drink. And once you understand what that is, manage it from there. Do you need to leave? Do you need to go to the bathroom and take a few minutes to breathe? Do you need to have a moment of peace, like watching a movie or you can watch, TikToks for a little bit, or again, you can leave. So those are some things, those are some boundaries that you can set for yourself. A couple of tricks too. I always encourage people, if you're dealing with addiction and you're going to a place that you know is going to have alcohol, have your own drinks. You can bring your own drinks. You can bring tea, you can bring Coke, you can bring Sprite, you can bring, whatever drink you're comfortable with. Or you can have a drink in your hand and sip it throughout the night. And again, when it comes to being around people that are drinking, they're going to ask you if you want something else. And I don't know if you've noticed this, but when you're at a place when people are drinking, they're going to look around whoever is drinking. And they're going to see, oh, who has an empty bottle? Who has an empty can? So I can help refill it. So if you sit with a can in your hand, or if you sit with a drink in your hand, they're not going to bug you. Or they're going to ask you, hey, do you need another? And it could be a Coke, it could be a tea. So those are some tricks that you can use whenever you're in situations like that. If you notice that somebody else is struggling with addiction and you want to vouch for them or advocate for them, if someone is trying to pressure them into drinking, because that sometimes happens too, support them and tell them, hey, this person said that they're not going to drink tonight. They don't need to drink tonight. You can vouch for them. And you can sit with that person. I know a lot of times when people are struggling with addiction, it's very hard for them to socialize because everybody's drinking, and that's a part of socialization. So you could sit with that person and talk to them and enjoy your time with them. I usually encourage people to, hang out with people that you feel comfortable with. And your circle is the first thing that, we look at whenever we're dealing with substance abuse, is who is supported, who is drinking, who is using substances, who are you getting your substances from, where are you going, are you going to bars, are you going to parties, things like that. Those are really important to look at. And again, those are some things that you guys can look at, or anybody else can look at, in terms of boundaries with yourself and boundaries with others.
Love that.
I have another question. Actually, I have a few questions, but I will say on the topic of substance for right now. So, do you think that oftentimes people who have substance abuse problems are chasing the feeling the substance gives them? For example, some people might use alcohol to relax. Like, it just helps me wind down, it just helps me relax. Versus some people might use alcohol because it makes them feel like, it gives them more confidence. Like, I can say whatever I want, I feel like I'm funnier, I feel like I'm the life of the party. I feel like they might be feeling the chase of confidence and like, I'm the cool person now, I'm funny now, or now I'm relaxed, now I'm calm. Or creativity, like, well, this substance, like, I just feel so creative when I use it, or, fill in the blank. So is there like, could you replace the substance with the feeling? Like, well, if you're feeling confident, if you're chasing confidence, do things that are going to make you feel confident. Or if you're chasing relaxation, how about you swap the wine every night to, like, I don't know, magnesium or something that might help you be mellow and calm, or tea or something. Like, is there like replacement therapy? Because a lot of behavioral therapy is replacing things to keep the same behavior, if that makes sense.
Yeah, absolutely. That's actually something that I discuss a lot with my clients, is especially with alcohol, there is a lot of after effects that people don't really know about. So whenever you're drinking alcohol, there's sugar. We're drinking a lot of sugar and a lot of ethanol. And so whenever we stop drinking alcohol, we crave food and we crave sugar. So whenever you're done drinking alcohol, you're going to want more sugar, you're going to want more food. So again, be careful with that because, you could replace the alcohol addiction with the food addiction. You can replace the alcohol addiction with a candy addiction, with a sugar addiction, and you can get addicted to sugar. But you can absolutely replace the euphoric feeling with something else. And like I said, there are some times when my clients will have an aha moment when they've stopped drinking or they stopped using. And let's say they'll go out to dinner with friends or they'll go out to dinner with their family or whatever. And I constantly say this, you can have fun without alcohol. You truly can. And when they have an aha moment, they'll be like, oh my gosh, I had such a great time at my friend's house and we didn't even drink. I'm like, there it is. You can have fun without alcohol. You can do anything else that gives you that euphoric feeling within reason that's healthy that can be fun. You can have a baking day, or you can watch your favorite movies together, or you can go out for a walk together and pick flowers, or pick rocks that you could paint, or something that you can do that would be a healthier choice to do that gives you that euphoric feeling. Because whenever we drink alcohol, it hits the opioid receptors. And that's why alcohol and opioid abuse is very, very similar in their withdrawal symptoms. They're extremely dangerous because they hit those opioid receptors. And when you drink alcohol, you're going to get that rush of euphoric feeling. And it's going to make you feel good for the moment. And that's why people become impulsive, because it does, hit that prefrontal cortex, and you get impulsive, you want to have sex, you want to go and do promiscuous things, you want to do crimes, you want to do all kinds of other stuff that is extremely impulsive or maladaptive. So that's going to be there for a little bit, but then you're going to start feeling that downer. You're going to start feeling down after that. So it's basically tricking your brain, telling you that you do feel good, but you don't. So when you're looking into things that could give you that euphoric feeling, it's exploration. You can explore that. You can explore different ways and different things that can give you that euphoric feeling. And Jenny raised her hand.
I just wanted to give a little bit of firsthand experience. I don't have any addictive behaviors when it comes to alcohol, so this isn't something that I struggle with. However, I did 75 hard. I actually did it twice. I know you guys know that, but the viewers don't, which that might end up being a whole other episode because I have lots of thoughts on the extremities of that, so we'll save that for another episode. However, one of the rules of 75 hard is to not drink alcohol. And I remember there was one time that I went over to a family friend's house. Love him so much. He's a sweetheart. He's so nice. He is an awesome person. However, we were all there to have fun and party, and everybody else was there to drink, but I wanted to make sure that I was staying disciplined with my goal to not drink alcohol for the entire 75-day experience. And he asked me, he was like, hey, you want a drink? And I was like, oh, no, I'm good. I'm doing this fitness challenge right now. Da, 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 da. And he was like, oh, well, just drink vodka. It doesn't have that many calories. It doesn't have carbs. And I was like, no, I'm good. That's not the reason why I'm doing it. It's not because, obviously it's a fitness program, so it's so that you can try and be a healthier person, but it's also because of the mental discipline. So I'm good. And he was like, no, come on, it's fine, it's fine. He kept trying to convince me over and over again. And again, it wasn't out of anything bad. He just wanted me to have fun. But looking back now, I'm like, dang, I feel so bad for people who are in those environments so frequently because especially in the Latino community, if they are trying to get better and say they have been doing so well for a certain period of time and then they go to somebody's house and they're like, fine, I'll do it. You know what I mean? It's hard because they do have that barrier there. And then the other thing that I noticed, and this is kind of what made me think of it, was when you said that they would be going to these events and they don't drink and they're like, I ended up having a great time. Literally, it was so weird. I kind of felt like I was drunk. Like I didn't have any sip of alcohol, but because everybody else around me was drunk, I was still having a fun time. I was having a blast. I was laughing. Everybody was being silly. And it was kind of interesting to see that that was my experience. So for those who are, maybe they don't have any history of addiction or they're not experiencing that path right now, but they're just sober curious, I encourage you to give it a try. See how it goes. If you're going to be going out one of these nights soon, just don't drink. See how it feels. And you would be surprised to find that you actually do end up having a really good time.
Absolutely. And I have something to add to that too, is when we get into situations where we're not drinking and we go into an environment where there is drinking, you kind of have your eyes open in the situation. You're like, holy crap, that's what I might have looked like when I was drinking. And it kind of throws you into this like internal work that you do with yourself. And so it kind of like hits you in the face a little bit whenever you don't drink and you're around people that drink.
Yeah. Val, I know you had a few other questions.
Yeah, so this is mostly for myself. So, in family planning, not that I'm family planning right now, but in the future, what are things that you can do to prevent that? I don't even know what it's called. I know you brought up the term, but like post-birth, like I
Postpartum?
know there's like a postpartum depression. Yes. Oh my gosh, thank you. Postpartum depression because
Okay.
um the baby is flooding you with so many hormones, and then you have the baby and then you have like a drop of hormones. So is there any science to like prevent, or is there any like, okay, if by day fill in the blank I still feel sad, there's something going on? Or is there, I don't know, like what was your experience, especially in our culture? And again, it's not that I think that, like, I don't know how to explain it. Part of being Latin or Hispanic is that we're surrounded by our loved ones and our family members. And again, it's so beautiful. But then also, when you don't have the feelings that they might want you to have, it's like, well, what's wrong with you? And then you're like, I don't know. Like, I also don't know. Like, tell me, because I would love to figure it out. So, like, what was that journey like? What can we do to prevent some of that if there is preventative work? I don't know, because that would be good so that I'm not sad after I have a beautiful child. And then, should I have a child and then I feel sad, like, what should I do about it?
That's a pretty loaded question. When you are experiencing postpartum depression, it depends. It depends on genetics. It depends on co-occurring disorders, and it depends on co-occurring conditions. All of those can be factors into why you have postpartum depression or anxiety or psychosis. So with the flood of hormones, there is some research. I don't know if this is true or not, but there are some research where you can prevent it, but you would have to start with therapy. Again, it's hormones. So whenever you're getting flooded with all of those hormones, it's very, very difficult. It's extremely difficult to contain your hormones because, again, they're your hormones. Just take prenatals, vitamins, be mindful of your mental health. If you see signs that you're getting sad, because there's stages. There's baby blues. Baby blues after having a baby lasts for maybe a couple of days to a week. But if it goes past that, then it's going to go into the depression part. And that's when you would need to get help. But there's a lot of factors that go into it and a lot of things to look out for. With postpartum depression, it could vary. So there is postpartum depression in terms of your baby might be harmed, or you might feel like you're going to harm your baby. Or you feel that you're going to have thoughts of your baby, or somebody else is going to have thoughts of having or hurting your baby. So it goes back and forth. There's another postpartum that mothers will feel disconnected with their baby. So they won't have a connection with their baby, and it'll scare them. It'll freak them out because they don't understand why they're not having that connection with their baby. And there's that fear again of like hurting their baby. So those can be signs of, those kinds of thoughts. It can be excessive crying. It can be, again, signs of depression. It can be outbursts of crying. It can outbursts of sadness throughout the day. It can be the lack of interacting with family or going out as much anymore, not indulging in the things that you used to love, or that you loved and you don't anymore. It's it's very typical of depressive symptoms and anxiety symptoms, but it's all surrounded your baby. So whoever is having a baby or who is looking to having a baby in the future, I highly, highly recommend that you look into the criteria and the symptoms of postpartum depression, anxiety, and psychosis, but also look into, I believe it's prenatal depression. It's depression while you're pregnant. So there's a lot of women that will experience depression while they're pregnant. So I highly recommend that you look into that as well. And then in terms
Wow,
of
thank you so much.
dealing
That
with
really
family,
actually. Oh, good. Hmm.
in terms of dealing with family in that stage of life and in the Latino community and your family, it's extremely difficult because there is this, again, this love for babies. There's this immense love for life and being born. I mean, with Catholicism and, baptizing the baby and, all this love and surrounding with the newborn baby. I experienced a lot of symptoms that I didn't understand before. That was part of the reason why I was so scary, because I didn't understand why I was feeling those feelings. So whenever you do get confused about those feelings because of your core beliefs and because of the way that you were raised, it can be very scary because you start to question, like, oh my gosh, like, what is going on? Is something wrong with me? Like, what am I doing? Is there something wrong with me? And so whenever you're dealing with that, it is good to look into getting a therapist to talk about it. But also, if you are experiencing some things like maybe pushback from family members or anxiety with other family members or maybe questioning, because the family can be confused by the postpartum depression or anxiety or psychosis, or it can be really scary for them too. So there can be a lot of confusion and there can be a lot of misunderstanding that flies around whenever you're feeling those feelings. So I highly encourage that you do, find some therapy so that way you can talk about it and you can find some sort of support. And maybe even family therapy whenever you're going through postpartum depression or anxiety. That could help as well, because you could bring the family in and you can help them understand how you feel, or they can express how they feel, and the therapist can moderate that and help everyone understand what is going on during this time.
Thank you so much. Yeah, actually, that gave me a lot of clarity. And also, like, should I be in that situation or have friends or know people, also be more understanding? Because I think we tend to not be understanding until we're going through it and we're like, oh, so that's what that feels like. So that conversation kind of laid out some steps, like before it happens, things that you can do to prevent. If you think that it might be happening, this is what it could look like, and this is what you should do. So that actually was a really good little blueprint for myself and hopefully others on like steps to take. So I actually really appreciate that, Victoria. Thank you so much. I don't have any other questions right now, but Jen, I'm gonna hand it off to you.
Yeah. So going back to the conversation of addiction, and while we are talking about how it can be a little bit more emphasized in the Latino community, I wanted to know what your experiences were in some of the demographics that you've worked with previously, like what those differences look like. Do you notice a difference between those who are in the Latino community versus other demographics, and like how prevalent alcoholism or any other kind of addiction tends to be?
Yeah, I actually noticed, and I did a paper a while back about this, but I did notice that with the work and the research that I've done, there is more alcoholism in the Latino community than there is with any other ethnicity. But it varies too, because with African Americans too, there's alcohol and then there's other substances that are prevalent. It also has to do with the region too, because different regions have different access to the substances. Alcohol does seem to be prevalent in Hispanic and Mexican communities. And can't remember what I had found out. It has to do, yes, so it has to do with immigrants. So whenever you're going into the States and you're coming from either Mexico or you're coming from Cuba, you're coming from, Peru, whatever, when you're coming into the States, you're going to deal with a lot of stuff when you're immigrating. You're going to deal with discrimination, you're going to deal with racism, you're going to deal with, the trauma of leaving your land. And so that's going to trigger more substance abuse. And they may realize it, but that's the reason why, a lot of these families come here and they get more addicted to these substances, especially alcohol. But because there's such a normalization of alcohol is not really seen as a major substance problem, especially because it's represented again like in media and movies and TV. It's seen as something to relax. It's seen as something to enjoy and party with and celebrate. So it's very normalized. But in my experience, because New Mexico has a lot of reservations, we have a lot of immigrants that are coming into the state, there is a lot of alcoholism that is surrounded by those ethnicities. And so I've worked with Navajo, I've worked with Hopi, I've worked with Sri Lankans, I've worked with Mexican immigrants. I've worked with all of that demographic, and they've had alcohol use problems because of either the immigrant status or because it was very much normalized in the family. And I also have noticed that in the Hispanic community that alcohol is very normalized. It's very, very much a social thing to have for different reasons, like for birthday parties and for hangouts or just, being there to watch a game or New Year's, Christmas, Thanksgiving. It's very much normalized as something to celebrate with. And it can very quickly turn into a binge. And a lot of people don't understand that when you have a problem with substances or alcohol, it can very much look like binging on the weekends. And that's it. You don't drink or do any substances through the week, but you can binge on the weekends and it's still a problem. If you're drinking like a 6-pack to a 12-pack on the weekend, it's still a problem. And it's a problem sometimes it could be, like I said, like high functioning or low functioning. You can be high functioning and you could do all the things that you can do, but you're still drinking that heavily, or it's debilitating you and you don't remember what's going on, or you're depressed, or you can't get out of bed and you feel lethargic. So yes, I hope that answers your question.
Yeah, no, and actually it answered multiple questions, because my next question was going to be how you notice that New Mexico differs from that, just because the demographics are a little bit different. I feel like it's mostly Mexican people and white people, and then all the other ethnicities are a lot less. And so that's obviously such a different experience in comparison to the rest of the United States. So that answered that curiosity that I had. I mean, you've pretty much answered a lot of the questions that I have. We do have a few more just to kind of wrap things up. So for those who are afraid to get help, whether it's for addiction, for alcoholism, or just going to therapy in general, what would you say to them that would encourage them to take that first step?
I always tell people that if you're struggling with addiction and you want to get help, go for it. And look for a therapist that deals with substance abuse. That would be the best bet, because I've noticed, and I don't know if it's just in New Mexico or if it's throughout, but I've noticed there is a lot of judgment from a bunch of other therapists whenever it comes to substance abuse. So I highly encourage that you find a therapist that deals with substance abuse and alcohol, so that way they have that knowledge already and they already know how to treat that addiction. If you're afraid to get into therapy, yes, it can be very intimidating and it can be very scary. It's all about finding the best fit for you. I mean, if you don't like the therapist that you get now, I mean, you could try again to, see another therapist. It's like buying a car. You got to find the right one for you. You can change, and I want to stress that, is that anybody that is dealing with an addiction or substance abuse, you guys can change. It's very hard. It's very intimidating, and it's a long journey. But you can change. Anybody can change if they want to address their addictions.
I have a follow-up question. So maybe not on the side of like someone going through like substance abuse or dealing with substance abuse, but being on like the party where maybe you're being supportive and encouraging. Because, okay, so maybe this is a good differentiation. How can you be supportive but not enabling? Like, how can you be like, hey, I want to see you thrive. I want to see you succeed. Maybe when you engage in these things, like you're just a different person, like you're just down or you're aggressive. Like, I want to see the best of you, and I don't think this substance brings out the best of you. Like, how can you be supportive and encouraging? Like, you want to encourage growth, but also like not an enabler. Like, how can you stop enabling? Because sometimes you're afraid you might push that person away. Like, if I say something, I'm not gonna see them anymore. If I say something, they're gonna cut me off. Or if I say something, how are they going to react? Sometimes you're afraid that that person is going to cut you out of their life because you say something. So how do you work that dynamic a little bit, especially in our culture?
With our culture, it's pretty difficult because, again, like I said, it's very normalized. But like I said before, speak to them with kindness and patience, and tell them what you've noticed. I can't stress enough to use that verbiage. I've noticed that you've been drinking a lot. I've noticed that, you've been angry lately. I've noticed. I have concerns. And now, something that you might not want to hear, you can't control them. If they're going to take you out of their life because you confronted them and you talked to them about it, it's out of your control. There's nothing you can do. The only thing that you can do is, like I said before, is give them that open door. Say, okay, I completely understand. I'm an open door. If you ever want to talk to me about anything, you can. I'm here for you. And just saying that frequently, and I'm not saying like weekly or, every day, but if you think about them and you're concerned for them, you can text them or call them, be like, hey, I was thinking about you. I hope you're doing well. And I'm here for you if you ever want to talk. And, if you want to talk, or if you want to look into resources, whatever, you can say that. With dealing with our community, you're probably going to expect some backlash. There's going to be backlash of like, well, that's just the way I am, or I don't have a problem, or how dare you say those things, anything. They could say any of those things, and that's out of your hands. There's nothing you can do about it. If they choose to be in that state and they choose to be in that addiction, that's up to them. There's nothing you can do about it. So the only thing that you can do is just tell them, I am here for you if you need anything. I've noticed that, yada, yada, yada. That's the only thing that you can do.
Okay. Thank you. That helped me out a lot. I really am going to take and use that.
Yeah. So the last question I have is, for those who feel hopeless on this journey, what would you say to them in regards to getting better? I know you briefly touched on the idea of change. It can feel hard, but encouraging people and reminding them that it is possible. Do you have any other words of encouragement that could maybe help somebody who might be going through a hard time in general right now, and like helping them get to the other side of that?
Say that, again, keep an open mind, and that if someone is reaching out to you and they're expressing their concern, again, it's up to you if you want to listen. If not, that's fine. But try to keep an open mind with that. And if you're experiencing an addiction, you can change. There is a light at the end of the tunnel, and you can get help. And I know in some communities and some cities and some states, they don't have enough resources. And I've noticed that there are some places that don't have enough resources. If that's the case, look into other cities that are close by. Look into, states if you need to. Move to another state if you need to, if you need more resources. I've had clients fly out to different states to go into treatment. because there's a lack of treatment here, honestly. But if you want to get help, absolutely go and get help. You can look into, again, Psychology Today. You can look into hotlines. I know there's hotlines for substance abuse and addictions. There's hotlines again, 988 for suicidal ideation. There's a bunch of online resources that you can look into. I mean, AA too. AA, Al-Anon, and any of those groups are very helpful for a lot of people. I've known a lot of clients that say that, that's really helped him, and then there's some clients that say that they don't like it. So it's up to you. You can explore on the resources that are out there and what works for you.
Yes, and we're going to put those resources in the description box as well. We're also going to link everything, all the books that Victoria talked about. I know you also have some educational information on your social medias. So where can our audience find you?
I am, of course, on Psychology Today, and I am also on Facebook and Instagram.
And again, we'll link that below. Recently, Val and I started linking our own information at the very end of these podcast episodes. So if you guys are curious on where to find us, you can find us there. Val, do you have anything to add before we wrap this up?
I guess first and foremost, I'm just really grateful for Victoria for being here and just sharing the really hard knowledge that it takes to earn a degree, get the experience, see all these clients, hours of just experience that she's been able to give us. So thank you. Also, family means a lot to me. And sometimes, family is a mixed bag and so people go through stuff. And so I think I needed to hear some of those words because who knows when I'm going to have to use some of those words like I've noticed or I've realized or I see this behavior. And it's always out of a place of love, but how to approach it, sometimes I say it's not what you say, it's how you say it. And so again, as somebody that loves her family, just having the tools to maybe make a difference, again, whether they take it, great. If they don't, well, darn, but at least you tried, so I feel like I added some tools to my toolbox. So thank you so much, Victoria.
No problem.
Well, I think that's going to wrap it up for today. Thank you so much for joining us, Victoria. And we will see you on the next episode. Bye.
Bye, you guys. Bye. Thank you.